Hi, my name is Eileen Mendoza, and my research project is on children's environmental health. So, what is environmental health? Environmental health is the relationships between people and their environment, and it promotes human health and well being. Environmental health also fosters healthy and safe communities, and environmental health officials work to make policies and programs that will reduce chemicals in the air, water, soil, and food, which protects people and provides communities with healthier environments. What is children's environmental health? Children's environmental health focuses on how the environment affects children's physical and mental development, and children are most affected by poor environmental public health systems. Why is children's environmental health important? So, due to their size, children breathe more air, they eat and drink more than adults, which causes them to take in more environmental toxicants. And reducing environmental risks could prevent 25% of disease burden in children under the age of 5. Why, um, why is children's environmental health important? So, children's health problems often come from their environment, which is where they play, live, and learn. Children of color and children living in poverty are disproportionately affected, and current policies and practices such as structural racism lead and continue to create health inequities within children's environmental health. So, some facts. In 2012, there were 1.7 million deaths in children under the age of 5, and these deaths are attributed to environmental factors such as respiratory infections and malaria, and 570,000 of those deaths were due to respiratory infections. 270,000 of those deaths were from neonatal conditions, and 200,000 deaths were from malaria. Communities with a large percentage of minority residents tend to have higher rates of mortality and environmental health hazard exposures compared to communities with a large percentage of white residents. So, some health outcomes of children's environmental health. One of them is asthma, and the exposure to environmental chemicals such as air pollution, mold, and secondhand tobacco smoke can worsen asthma symptoms, which are wheezing, breathlessness, coughing, and chest tightness. And this can reduce the ability to control those symptoms. Another one is cancer, which is the second leading cause of death among children between the ages of 1 and 14 years old. So, the changes in patterns of exposure to chemicals introduced into a children's environment can be the cause of cancer. And cancer treatment during childhood can lead to significant lasting physical, cognitive, and psychological effects. Another one is immune function. So the prenatal and early life environmental exposures can interfere with the function and regulation of the immune system, and any interferences to the immune system can contribute to autism spectrum disorder and other brain developmental disorders, which include lower IQ, problems in social behavior, and poor motor skills. And lastly, we have neurodevelopment, and the exposure to chemicals such as mercury, lead, arsenic, and pesticides can have negative effects on brain development. And this leads to cognitive delay, attention deficit hyperactivity disorder known as ADHD, a lower IQ, higher rates of anxiety and depression, behavior and learning disorders, and reduced self-regulatory capacities and shortened attention span. Some environmental impacts are air pollution. Children are exposed to more air pollutants than adults because they have higher breathing rates, are more physically active, and spend more time outdoors than adults. Air pollution can affect respiratory health and contributes to upper and lower respiratory infections and asthma exacerbation. Air pollution exposure can affect infant mortality, weight, and pediatric cancer. A second environmental impact is bisphenol A, known as BPA, And BPA can be found in water bottles, baby bottles, toys, and receipts. And it can be exposed through eating food or drinking water that has been processed with plastic that contains BPA. Some studies found that the level of BPA is low enough to not have any concern, but recent studies have shown that even low levels of BPA in animals have had subtle effects, which has caused some concern for how these low levels of BPA can have in children. Lastly, we have secondhand tobacco smoke, which is a complex mixture containing over 7,000 chemicals, including toxic and carcinogenic compounds. And these chemicals can cause negative health effects, including preterm birth, impaired fetal growth, respiratory illness, and neurological problems that was mentioned. So, what can be done? With communities, we can meet with community members to identify resources, needs, and environmental health priorities. So, state and local governments have to prioritize how resources are spent and includes what services are provided and promoted. And learning directly from them can determine where to focus those resources. Involving community members in the development and implementation of environmental health communities for children. So, state and local health departments should meet with community members again to collaborate and get any feedback on any existing strategies within communities, and can talk about what has worked, what has not worked, what can be done, what can be improved. We can also actively partner with schools and child care centers to offer environmental health education. So that way staff at schools and child care centers can know about the warning signs of environmental health hazards and exposures. Lastly, we can also develop an environmental health surveillance and information system for children in school and child care settings. So the state or environmental agencies can create reports. Then they can be able to receive complaints of environmental risk and exposures at schools, which leads to investigation that will identify causes and explore patterns. So that is it for my project on children's environmental health. These are some of my references. Thank you.